Bismillahirrahmanirrahim. Assalamu alaikum. Couple of months ago, my dear friends Dr. Muslim Atiq and Dr. Muhammad Saleh of Shifa International Hospital had kindly invited me to Islamabad to share my thoughts on compassionate care and counseling in GI and liver diseases with their esteemed team. Due to my busy schedule, I could not be physically present among them, which I truly regret. However, to honor that commitment and to remain connected with my dear friends, I have prepared this recorded lecture. I sincerely hope it conveys my message and adds value to clinical practice. Dear Dr. Muslim Atiq and Dr. Muhammad Saleh, thank you for your understanding, and I look forward to meeting you in person sometime soon, inshallah. Bismillah ar-Rahman ar-Rahim. Dear colleagues, when we talk about gastroenterology and hepatology, our minds often rush toward diagnostic algorithms, staging of fibrosis, and the latest interventional procedures. But let me ask you, what do our patients remember the most? Is it the dose of lactulose we prescribed, or the time we sat beside them, listened with empathy, and reassured them in their moment of fear? I want to share a small story with you. A middle-aged man with advanced cirrhosis was admitted under my care. He was jaundiced, had ascites, and his family was extremely worried. We started all the right medicines, did all the right procedures. Clinically, everything was as per protocol. But what struck me was when, during rounds, his daughter quietly said, "Dr. साहब, अब्बू आपसे बात करके ज्यादा बेहतर महसूस करते हैं दवाइयों से कम." Doctor, my father feels better after talking to you than from the medicines. That one sentence reminded me that while pharmacology and procedures are essential, it is our compassion, presence, and counseling that truly heal the invisible wounds of fear, loneliness, and despair. This is what today's discussion is all about. Bridging the science of medicine with the art of empathy. Medicine cures the disease, but compassion heals the person. A prescription may save a liver, but empathy can save a life. Patients don't come to us only for treatment. They come to us for hope. Listening is often the most powerful intervention we can offer. In gastroenterology, we treat the gut and the liver, but never forget The heart must be part of the healing. Good doctors know the science. Great doctors practice compassion. Counseling is not an extra. It is an essential part of clinical care. Remember, counseling is not an extra. It is an essential part of clinical care. So today's session on compassionate care and counseling in GI and liver diseases is about revisiting that human side of medicine, the side that turns a case into a person, transforms despair into hope, and makes us not only better physicians, but better healers. Compassion care and counseling in GI liver diseases, it's bridging science with empathy, healing beyond prescriptions. And remember, good doctors cure, great doctors care. Why compassion matters? Patients remember how we made them feel, not just what we prescribed. GI and liver diseases often carry fear, stigma, and uncertainty. Compassion reduces anxiety, improves compliance, and strengthens trust. And empathy is therapeutic in itself, remember. The human side of GI and liver care. We know cirrhosis. In this condition, patients live with chronic fear of complications. In IBD, young patients face stigma, isolation, and depression. In cancer, families seek not only cure, but also comfort and dignity. And counseling is connecting, listening, and guiding. So our goal today is to understand the role of compassion in clinical practice, explore techniques for effective patient counseling, share stories, reflections, and practical approaches, and commit to being not just treaters of disease, but healers of people. When I searched the word compassion, I came across several different meanings. One, sympathetic pity and concern for the sufferings or misfortunes of others. Another meaning, a feeling of deep sympathy and sorrow for another who is stricken by misfortune, accompanied by a strong desire to alleviate the suffering. And another meaning, sympathetic consciousness of others' distress together with a desire to alleviate it. But the words that clicked for me were to suffer together. Poverty, mental illnesses, and evil actions cause hurt. It would be fair to say one of these hurts has affected us as well. Each day, we wake up and focus on ourselves and family. Do we think about those whom we encounter throughout the day? What about the neighbor 2 houses down? What about our co-worker? Do we think about them the way we should? Probably not. Compassion is defined as the feeling that arises when you are confronted with another's sufferings and feel motivated to relieve that suffering. Compassion consists of 3 facets: noticing, feeling, and responding. You notice somebody with some condition, you feel that suffering, and then you respond. So the compassion has got all these 3 components: noticing, feeling, and responding. Empathy. What's empathy? It's the feeling as another. What somebody's feeling, if you feel that, this is called empathy. Then we are hearing the word sympathy. Sympathy means feeling towards another and response to suffering of others with sorrow and concern. So in empathy, you just feel as another, while in sympathy, you feel towards another and you respond to suffering of those with sorrow and concern. But as compared to these two, the compassion, it's feeling for another and responds to suffering of others with warmth and care. This is the difference between these 3. Empathy, feeling as another; sympathy, feeling towards another; and compassion, feeling for another. There is no response in empathy. There is a response in sympathy and compassion. In sympathy, the response is with sorrow and concern, while with compassion, the response is with warmth and care. So we should be clear about these feelings. Compassion care is a holistic approach to healthcare that combines emotional support with medical treatment. So it's a medical treatment as well as emotional support. It focuses on addressing the person as a whole and considers their physical, emotional, social, and mental well-being. Compassion care has 5 elements, and these are empathy, respect, communication, sensitivity, and support. If any one element is missing, it's not compassionate care. If you want to extend compassionate care towards your patient, you should show empathy, respect, communication, sensitivity, and support. The empathy involves understanding a person's experience from their perspectives. You must actively listen to patients' concerns without judgment. Just keep on listening. Make no opinion. This helps create a space where patients feel comfortable expressing their fears and emotions. For instance, a person with chronic health condition may feel anxious about his treatment. You must listen to him attentively, acknowledge his feelings, and offer reassurance. This will help him heard and understood. The second component is that of respect. It means treating every person with dignity and honoring their values and preferences. This may include using their preferred pronouns, ensuring their privacy, and involving them in decisions regarding their care. When discussing treatment options, you must respect a person's decision-making process and ensure that their cultural or religious beliefs are considered before moving ahead with the treatment plan. Then comes the third component, that is communication. Communication is important in building trust between healthcare professionals and people. It involves clearly explaining diagnosis and treatment plans in simple terms, as well as addressing any questions or concerns. When delivering a difficult diagnosis, you must take time to explain the situation in a straightforward way, without lots of technical language. This helps ensure that a person understands all their options and feels empowered to ask questions without feeling rushed. Then the fourth element is that of sensitivity. Sensitivity requires awareness of the cultural, emotional, and psychological factors that may influence a person's healthcare experience. You must personalize care to accommodate these factors. For example, a person from a community with strong cultural beliefs about healthcare may be hesitant about certain treatments. A sensitive healthcare professional takes time to understand these beliefs and adjust their care approach accordingly. This ensures that the person feels respected and supported. Fifth and the last element is that of support. Support involves offering physical, emotional, and informational help throughout a person's healthcare journey. It may include guiding them through challenging treatments, helping them cope with anxiety, or connecting them to additional resources like therapy or support groups. For example, a person undergoing chemotherapy may need both emotional and physical support. A compassionate healthcare professional not only offers reassurance during treatment, but also connects them with support groups for people in similar situations. So, why is compassion important in healthcare? And all these 5 elements. Compassion is important in healthcare because it helps bridge the gap between clinical treatment and human experience. When healthcare professionals treat people with compassion, they acknowledge that people are more than their medical conditions. Compassionate care can help a person feel more comfortable and respected. This, in turn, encourages openness and trust. A compassionate approach also ensures that healthcare professionals understand each person's unique needs and preferences which can lead to better personalized care plans and improve healthcare outcomes. So the compassionate care and counseling in GI and liver diseases. Let's show some examples. Avoid medical jargon. Empathy in action. Use words and tone that show understanding. Use open-ended questions. For example, what concerns you most today? Reflect feelings. For example, you say, it sounds like this has been really tough for you. And validate emotional reactions by saying, for example, it's understandable to feel this way. You should use patient-centered language. Avoid saying fatty liver due to bad lifestyle. Say, your liver has accumulated fat and we can reverse it with the right steps. Shared decision making. For example, you say, what's important to you as we move forward? It should be having motivational interviewing. Guide the patient, don't push the patient. Help patients explore their own reasons to change. So let's take an example of irritable bowel syndrome. Clinical scenario, a young woman with IBS complains of daily bloating, discomfort, and unpredictable bowel habits. She has been told by others, it's all in your head. So the compassionate response by you in such scenario can be acknowledge her suffering by saying, I believe you. What you are experiencing is real and painful. Offer reassurance by saying this is a manageable condition and you are not alone. Discuss a step-by-step plan, diet changes, stress management, and possible medications. Encourage her to keep a symptom diary to feel more in control. Another example, inflammatory bowel disease. Clinical scenario, a young man with Crohn's disease fears social embarrassment due to urgency and bowel frequency. Your compassionate response in this scenario may be validate his concerns by saying, many patients feel anxious in public due to these symptoms. You are not alone. Discuss practical tips, toilet access, diet planning, and emergency kits. Offer psychological support for anxiety or depression. And involve patient in shared decision making about medications or surgery. Let's go to another example, the most common one, the fatty liver disease, MESL and MASH. Clinical scenario, for example, a middle-aged man with MASH is struggling to lose weight. He feels ashamed and frustrated. So your compassionate response in such case may be avoid blame. This is not about willpower. You can say this. Many factors influence weight and liver health. Avoid shaming language. Instead of you need to lose weight, say let's work together to make small changes that protect your liver. Provide hope by saying even modest weight loss Just 5 to 10% can improve your liver significantly. And involve a nutritionist and create realistic goals together. Ask about stressors at home or work that may be affecting self-care. Another example we daily come across is the chronic hepatitis B and C. Clinical scenario: woman with newly diagnosed hepatitis B feels scared, isolated, and afraid of infecting her family. Your compassionate response in such scenario should be normalize the conversation by saying, "You are not alone. Millions live healthy lives with treatment." Reassure them about transmission and safety. You can hug, share meals, and be with your family. Provide emotional reassurance. You can live a long, healthy life with the right care. And gently correct misconceptions, explain how it spreads, how to protect family, and dispel stigma. Ensure follow-ups for antiviral therapy and monitoring. Link her with support group or community resources. Then another disease you may come across is the alcohol-related liver disease. A clinical scenario: a man with cirrhosis due to alcohol is in denial and feels judged by family and doctors. Compassionate care in such scenario: use non-judgmental language. Let's focus on helping your liver recover. Stopping alcohol is the first step, and we are here to support you. Offer referral to addiction counseling or support groups. Show respect and avoid shame-based conversations. Reinforce small wins. I'm proud of the effort you are making. You can say this. Then another scenario in GI is the compensated liver cirrhosis. Clinical scenario: a patient newly diagnosed with liver cirrhosis is scared and confused. Your compassionate response in such scenario: sit with the patient and explain the condition calmly. Answer all questions without rushing. Acknowledges his fear. Ensure a follow-up plan with a dietitian and counselor. The patient leaves feeling informed, support, and hopeful. Now the scenario of a decompensated liver cirrhosis. A patient with decompensated liver cirrhosis struggle with cognition, poor memory, lack of concentration, and frequent loss of temper, resulting in shame and family tension. Of course, he is in hepatic encephalopathy. So the compassionate response in such case may be: speak slowly and reassure. For example, you say you feel foggy sometimes. That's from toxins your liver cannot filter well. We can manage this. Encourage family involvement and train them on medication, schedules, signs of confusion, and diet. Offer caregiver support. It reduces burnout and improves patient outcomes. Another scenario: an elderly patient with end-stage liver disease is told he is not a transplant candidate. So a compassionate response in such case: speak gently and clearly. We can't offer a transplant, but we will never stop caring for you. Discuss palliative options to manage pain, ascites, or encephalopathy. Involve family early in care planning. Provide dignity, presence, and space for spiritual or emotional conversations. Another scenario: a patient with decompensated liver cirrhosis has been diagnosed with vaso-invasive multifocal HCC. Your compassionate response in such scenario may be: we know this is a moment for deep human connection. Listen with heart and speak with honesty. Be gentle but truthful by saying, we can't cure this, but we can care for you in every way possible. Explore what matters most to the patient: family, faith, and comfort. Involve palliative care early, not just in final days. Document wishes clearly. Advanced directives: do not resuscitate, that is the DNR orders, pain management. At the core of human behavior lies a fundamental question: do we act for our own benefit or the good of others? This question introduces the concepts of egoism and altruism, two opposing yet equally important aspects of human motivation, and how these two are interconnected via compassion. Let's explore these concepts from a healthcare perspective, exploring their influence on ethical decision making, their impacts on patient care, and their roles in shaping a more compassionate society. First, let's understand egoism. Egoism may be defined as the view or attitude where a person gives primary importance to their own interests, needs, or happiness. In philosophical sense, ethical egoism in moral philosophy argues that actions are morally right if they promote one's own good. Psychological egoism, on the other hand, claims that all human actions are ultimately motivated by self-interest, even when they look altruistic. For example, if someone donates to charity mainly because it makes them feel good or improves their reputation, this reflects egoistic motivation. Egoism, that is anaparasti or nafsparasti, in Islam, let's have Islamic perspective. In Islamic terms, egoism is related to the nafsul amada, the compounding self, which pushes a person towards selfish desires, greed, arrogance, and neglect of others. The Quran warns in the 53rd ayah of Surah Yusuf, Innal nafsa lamara bisu, बेशख्स नफ्स तो बुराई पर उकसाता है. Indeed, the soul is ever inclined to evil. Egoism in its extreme form becomes self-worship, that is nafs ki ghulami, where a person pursues only their own interest, wealth, or comfort, ignoring the needs of others. Now let's understand altruism. Altruism is the opposite tendency, acting for the benefit of others, sometimes even at the cost of one's own comfort, interests, or survival. In philosophical sense, ethical altruism holds that the moral value of an action lies in its benefit to others, not to oneself. For example, a person who risks their lives to save a stranger from danger demonstrates altruism, as their action is focused on the other's welfare. The concept of altruism in Islam. The Quranic concept closest to altruism is isar, giving preference to others' needs over one's own even when one is in difficulty. Allah praises this quality in the 9th ayah of Surah Al-Hashir. وَيُسِرُونَ عَلَىٰ أَنفُسِهِمْ وَلَا كَانَ بِهِمْ إِسَاسًا, जो अपनी ज़ात पर उनको तरजीह देते हैं अगरचे खुद उन्हें सख्त ज़रूरत हो. They give others preference over themselves even if they are in need. For example, the Ansar of Medina shared their homes, food, and wealth with the Muhajirin, showing selfless love and generosity. The Prophet ﷺ said, "None of you truly believes until he loves for his brother what he loves for himself." Quoted in Bukhari and Muslim. This hadith is the essence of altruism. One's faith is incomplete without selflessness. Now understand the compassion. Compassion is the deep awareness of another's suffering, accompanied by the motivation to relieve it. Compassion can fuel both altruistic and egoistic actions depending on the underlying motivation. For example, compassion with altruism is helping a poor person by giving food without expecting anything in return. Compassion and egoism in disguise, helping someone mainly to feel proud, superior, or relieved of guilt. The concepts of compassion in Islam. Compassion, the closest meaning of compassion in Urdu will be rahmat, shafqat. We know compassion is central to Islamic ethics. Both Allah's names, Al-Rahman, the most compassionate, and Ar-Rahim, the most merciful, emphasizes compassion. The Prophet ﷺ is described in the 107th ayah of Surah Al-Anbiya as वमा अरसलनाका इल्ला रहमतुल लिल आलमीन, और ए नबी, हमने आपको तमाम जहानों के लिए रहमत बनाकर ही भेजा है। एंड वी हैव नॉट सेंट यू, ओ मुहम्मद, एक्सेप्ट as a mercy to the worlds. Prophet Hazrat Muhammad sallallahu alaihi wasallam said, "The merciful are shown mercy by the most merciful. Be merciful to those on earth, and the one in the heavens will be merciful to you." Quoted in Tirmizi. Compassion in Islam is not only feeling for others, but taking action, feeding the hungry, helping the sick, forgiving the wrongdoer. Relationship between egoism, altruism, and compassion. We see compassion as a bridge. Compassion is the emotional root that can lead to altruistic actions. But human psychology is complex. Compassion can also be mixed with egoistic desires. So the spectrum is pure egoism, which means self-centeredness even if others suffer. Then pure altruism, complete selflessness even if it harms oneself. And compassion lies in between because it's other focused like altruism, but it can also satisfy one's inner emotional needs like egoism. So it's a bridge between these two, or it has got the good parts of altruism as well as the good components of the egoism. In a philosophical debate, some argue there is no pure altruism, since even compassionate acts give inner satisfaction, egoistic benefit. Others say that does not reduce their value because the action still relieves sufferings. So, in summary, egoism means for me, altruism means for you, compassion means I feel your pain, let me respond, which may lead to altruism but sometimes blends with egoistic motives. I would like to show you this figure, very, very important. The circle, the outer and the inner. This is a total self. Someone's, mine, yours, total self. The big circle represents the total self, our full human personality. The inner and outer. Inside this, there is a conceptual ego, the sense I, that organizes your experiences. After understanding this, the total self and the inner self, let's concentrate here on the egoism. The small curved arrows at the top show egoism, these ones. A movement of energy turned inwards towards self-interest here. So egoism, actions are done for one's own benefit. If the ego gets dissociated, cut off from the whole self, like here, it becomes a mere ego. Meaning it lives in isolation, focused only on itself, not the greater reality. This is danger of unchecked egoism, self-centeredness. So if someone is here, it is just mere ego. But if someone goes out of this self, but still it is for his inner side, this is egoism. So this is ego, this is egoism, but it is centered towards inside. Then altruism. A small outward arrow represents altruism, this one. The ego extending itself towards others. It is still a function of the ego. We know it starts from here, since it is intentional action from the self, but now oriented outward. Here it is originated from himself, and it is both a bidirectional. This is one directional, helping others. In simple terms, the ego is not dissolved, but redirected towards serving others. Then comes the compassion. The thick downward arrow labeled compassion is much longer and stronger. It represents a deeper force of the total self. Beyond just the ego. Compassion flows from the whole person, not just the ego, and connecting one's being to others, suffering in a more profound way. That's why it is shown as descending directly from the core of the self, not from the outer edge, just like this. So egoism is from the outer edge, from the ego sense. Altruism is from the inside, but outwards. Compassion, you feel, you see, you notice, you feel, and then you respond. So the key message of the diagram is egoism is the ego looped back on itself, self-interest. Altruism is the ego reaching outward but still ego-based, this one. While compassion is deeper, more fundamental than ego, it comes from the total self. If the ego dissociates from the whole, like this, it becomes mere ego. But when the ego is integrated into the total self, compassion arises naturally and altruism becomes authentic. So in simple words, or in plain words, the diagram is showing that compassion is not just another function of the ego, like egoism or altruism. Instead, it is rooted in the total self, transcending the ego, and when it flows through, it purifies the ego, making altruism possible in its true sense. Egoism is acting in one's own self-interest, while altruism is the unselfish concern for others, well-being, often a personal cost. Compassion is an emotion, that a quality that derives both altruistic and self-compassionate actions, involving a deeper empathetic connection that can shift focus from self-centered concerns to the broader well-being of others. These concepts represent different motivations for behavior, with altruism and compassion being seen as positive pro-social behaviors that benefit others. So the caring with compassion means empathy, where it's interest, listening and head, sympathy, warmth, kindness and hurt, and altruism, care, actions and hands. The tension between egoism and altruism in healthcare professionals often face the challenge of balancing egoism and altruism daily. On one hand, they must consider their interests, such as personal safety, and professional boundaries. On the other hand, they are committed to promoting the health and well-being of their patients even when it involves personal sacrifice. Navigating this ethical landscape requires empathy, self-awareness, and a strong personal and professional growth commitment. So, striking a balance, building a more compassionate society, a society that values egoism and altruism, fosters personal growth while promoting a culture of compassion and support. By understanding the role of egoism and altruism in healthcare, we can create more empathetic and informed healthcare policies, build healthier communities, and foster greater well-being for all. So, in conclusion, egoism and altruism represent two sides of human experience, each shaping our motivations, actions, and moral reasoning. By exploring these concepts through a healthcare lens, we can better understand the factors influencing patient care and ethical decision making. Ultimately, acknowledging the importance of both egoism and altruism can help us build a more balanced, empathetic, and compassionate society. So, the frequently asked questions: can egoism ever be a positive force in healthcare? Yes, egoism can inspire personal growth and encourage self care, ultimately benefiting healthcare providers and patients. Another question: are egoism and altruism mutually exclusive? No. Individuals can exhibit both egoistic and altruistic tendencies, and the balance between the two may shift depending on context and personal value. The third question: how do healthcare professionals balance their own well-being with the needs of their patients? Answer is, healthcare professionals must set boundaries, prioritize self-care, and develop empathy to maintain balance and provide quality care. The another question: can society encourage altruism without neglecting self-interest? Yes. Society can nurture altruism by promoting empathy, encouraging voluntarism, and creating a culture of compassion while still valuing self-interest. Key takeaways: compassionate care is when a doctor treats a patient the way they would want their own family member to be treated. In GI and liver disease, compassionate care is not just about prescribing drugs, it is about offering hope, presence, and human connection. Whether it is through diet guidance, listening without judgment, or just sitting silently with a patient during a tough moment, it all matters. Patients remember kindness more than procedures. Make compassion your clinical habit. Compassion is not optional. It is essential to healing. You may not always have the cure, but you always have the power to comfort and connect. Let your presence, words, and silence carry healing. The best medicine may not be in your prescription pad, but in your heart and your words. Let's heal not only with our knowledge, but with our presence, compassion, and empathy. Treat the disease, but never forget to touch the life. 1 minute reflection. Before we close, I want you to take just 1 minute. Think of one patient you remember. Not because of the diagnosis or treatment plan, but because of the human connection you shared. Maybe it was someone who cried in front of you, or someone who just needed your reassurance. Now ask yourself, what made that moment memorable? Was it the medicine or the compassion? Final thoughts? Patients may forget your diagnosis. Patients may forget your diagnosis. They may forget your prescription. But they will never forget how you made them feel. As we move forward in our careers, new drugs will come, new endoscopic technologies will evolve, and guidelines will keep changing. But one thing will always remain timeless: the power of compassionate care. For our patients with cirrhosis, inflammatory bowel disease, or cancer, the real medicine is often not just what we write on the prescription page, but the comfort and dignity we provide through counseling, empathy, and presence. So, let us commit not only to treat diseases, but to touch lives. Because in the end, patient may forget what we said. They may forget what we did, but they will never forget how we made them feel. Once again, I'm grateful to my friends, Dr. Muslim Atiq and Dr. Muhammad Saleh, for their kind invitation. Although today I could only join you through a recorded message, my heart and prayers are with you in your noble mission of patient care. Inshallah, I look forward to meeting you in person and learning from your experience as well. Thank you very much, and may Allah bless your efforts.